Hey, everybody. Welcome to the Health Babes podcast. I'm your host, Dr. Becky Campbell with Dr. Crystal Hone. Today we have Dr. Alan Bauman. He's an MD. He is a hair transplant surgery specialist in Boca Raton, Florida. He has over 28 years experience in the medical field. He received his medical doctorate degree from New York Medical College and had internship and residency training in surgery at Beth Israel Medical Center and Mount Sinai Medical Center in Manhattan before specializing in hair transplant surgery and the treatment of hair loss, including primary androgenetic alopecia and hereditary male and female pattern hair loss. He is affiliated with Boca Raton Regional Hospital, and he came to national prominence in 2006 for his role in pioneering eyelash implants at the world's first International Society of Hair Restoration Surgery live surgery workshop for eyelash transplantation in Torrance, California. He has been credited with pioneering low-level laser therapy for hair loss, minimally invasive follicular unit extraction hair trans, PRP, platelet-rich plasma, prostaglandin analogs for hair growth, hair loss genetic tests, and live surgery webcasts. So we talked all about all of his different methods. He does everything from functional medicine in his office for helping you with your hair loss to actual hair transplant surgery. So this was a really interesting episode, and we hope you love it. So let's welcome Dr. Bauman to the show. I'm so excited to have you. This is a topic that we get asked a lot about, and we don't really know. I mean, we can tell you some things you can do with your diet and with your health and all that type of stuff, but you're really the man with this. So we're excited.
Well, thanks so much. Thanks so much for having me, ladies. Really, it's a pleasure and an honor to be here with you.
Yeah.
So how did you get into this? Like, can you share your story on why you decided to become a hair restoration surgeon?
Yeah, so I wasn't born a hair restoration surgeon or hair transplant surgeon. Although, if you asked my grandmother, probably when she was alive, when did Alan decide to go to medical school? She probably would have said something like the day he was born.
Oh,
So it was a little bit preordained, doctors or attorneys or things like that, in my family. So it was a good thing I was pretty good at biology and science and math and so forth. But one of the interesting things that happened to me when I was a teenager in the 80s is that I had a chance to meet a very, very prominent plastic surgeon from Manhattan. And he kind of took me under his wing. He showed me surgery really behind closed doors, which in those days, you couldn't just go on Snapchat or YouTube or even Discovery Channel didn't have anything graphic. So surgery was like, kind of an unknown thing. And I was always interested in working with my hands. And so my original path was towards plastic surgery, cosmetic surgery.
okay.
And I always just loved watching him work, do his work, and also meeting his patients who had had such amazing results from the procedures that he did. But it wasn't until years later, after medical school and in my training, did I actually meet a hair transplant patient who had had a hair transplant, and I was unable to tell that
Yeah.
the hair was transplanted. And again, this seems kind of unusual today because maybe we take for granted that procedures with modern methods are not painful or pluggy anymore and so forth. But again, back in the 1990s, this was kind of unusual. And when he mentioned he had a hair transplant, I looked at him and I'm like, wow, can we talk about this?
Yeah.
What's going on here and how come I can't tell? And so he was pretty excited to tell me about how he chose his surgeon and from a layman's point of view, working with single hair follicles. And but really, the most important thing that I remember from that brief conversation was how his life was changed by the hair. And he related to me kind of his change in social status and his profession and how regaining his confidence and so forth really changed his life from that moment forward. So then I thought, wow, maybe I should look into this.
Yeah.
I could probably add this to my repertoire, for plastic surgery and things like that. And eventually, just to make a long story short, I found another mentor who also took me under his wing, showed me the ropes in hair transplantation. And I thought it was just going to be a small little thing and then I would just add it to all the other stuff that I was learning. But it ended up overwhelming me essentially in my interests. And I decided to completely specialize in hair restoration from that point going forward. And I moved down to Boca with my wife. We were engaged at the time in the late 1990s, and that's when I opened up my practice. And today, as my parents say, it's a 25-year overnight success. I've treated over 33,000 patients, and you probably mentioned all that in the intro. But it's a fun practice to have, and we still continue to change people's lives day in and day out. And 50% of my patients are men, and 50% are women. So
Oh,
Oh,
I'll kind of leave it
wow.
there. And and what we do day in and day out is help people look good and feel great by restoring and maintaining their own living and growing hair using truly effective treatments.
I
It's
love it.
amazing the difference in how it looks now compared to when, you could see like the plug, you could see
Mhm.
it. And I don't know if you know who this is, but there's an artist named Machine Gun Kelly, and he has a great head of hair. And I found out that he had hair restoration. And I was like, no way. There's no way. It
Mhm.
looks so good. And so anyway, I mean, I cannot get over how well it looks so realistic. It's crazy.
Oh, absolutely. Well, I mean, the change from those many decades ago, from moving literally like a plug or a punch of skin that contained 30 hair follicles, perhaps, to what we do today with single follicle implantation into the hairline with the appropriate angle, orientation, and position. And of course, even what we do with eyebrows and eyelashes as well, give us a very, very unique control over the final outcome, and the artistry is really the critical component. And so there are many what I would call hair heroes out there who have had great work done, uh, you know, uh, not just by myself, but by many other surgeons, talented surgeons out there. But unfortunately, there's, the ones, as you know, in cosmetic surgery, there's the good and the bad out there
Yeah.
too. So,
Mhm.
and the ones that you notice are typically the ones that are not so artistic, right?
Right.
Yeah.
So people flying back from overseas with a straight across hairline in their forehead, bleeding on the plane, that's probably
uh
not such a great idea. So.
For
I
sure.
I was gonna ask you if you did eyebrows because I'm in desperate need of an eyebrow hair transplant because I had good eyebrows until I got Hashimoto's disease. And then I literally from like here on don't have much eyebrow hair. And then I had really bad microblading. And then I had that removed over
That
like
was a
a
production.
ridiculous process. And then I just re-had microblading done again, but I don't really want microblading. I want hair.
Yeah,
And you're right down the street.
I
you
mean, it's
absolutely.
meant to be.
It is.
Oh, you
So,
absolutely have to come by. We do a lot of eyebrow transplantation. Remember that eyebrow transplants come with scissors. And
Yes,
so
I've
the
heard
reason,
that. You have to cut
because
it
we
a lot
take,
because it's head
yeah,
hair. Yeah.
oh,
correct, correct. So
absolutely.
those follicles are pre-programmed to grow pretty long. And so
Hmm.
you got to be prepared for that. But yes, many women who live through, the wafy, thin brows of the 80s and early 90s are now regretting it. And of course, even if you cure your thyroid conditions,
Yeah, it's hard.
usually the hair still does not grow back. And
No.
unfortunately, and so eyebrow transplantation is a beautiful way to permanently restore those brows. Even if you decide to use some shading, with permanent makeup and blading and such,
Hmm.
you need that three-dimensional hair to really
Yeah.
give it, and not to say you need the Kardashian look, but understand the thicker look, right?
Oh, I love it. So, Dr. Allen, what are some of the main causes of hair loss in both men and women? Because I know it can represent or present in different ways, right? Especially with both genders. So, can you go into that a little bit?
Oh, absolutely. So, in men and women, the primary cause of hair loss is genetic. So, you do inherit this sensitivity that's going to miniaturize or weaken the hair follicles. And of course, it looks different in men and women. It expresses itself differently, meaning that in men, you typically see the receding hairline first, some thinning in the crown a little bit later, perhaps, and then it can basically obliterate all of the hair on the top
Yeah.
of the scalp. And for women, it looks a little bit different. Typically, women will complain of a widening part line, loss in the frontal zone in terms of volume and coverage, and then later on, they may have a little bit of a receding hairline. But what I've learned is that it's not just a sensitivity to your hormones. And in men, we know it's specifically DHT, dihydrotestosterone. In
Mhm.
women, we see hair loss around the time of childbirth,
Mhm.
menopause, perimenopause, and other hormone imbalances. But we now take a very holistic approach because everything from sleep dysregulation to what you're eating in your diet to whole body inflammation to your immune status to medications that you might be taking or underlying medical conditions, we really take a very well rounded approach today to take a look at all of these different factors and really dissect down into what are the root causes that could very much dysregulate your hair. Whether it's a massive shed, that might be different than like hereditary female pattern hair loss, although you could have both.
Yeah.
It can happen, like with COVID, you know, you can have an
Yes.
underlying condition like hereditary hair loss, but you may not have you know, maybe you wouldn't even have seen it for another decade or so. And then all of a sudden, boom, you know, you're hit with some heavy duty medical, you know, problem, COVID, of course, cytokine storm and everything else that goes along with it. And then all of a sudden, boom, you're in a big shedding phase.
It's so true. So, because we work with a lot of post-COVID patients, and it's so sad. You know, it's hard when men lose their hair for sure. I think it might be harder for women because I think it's kind of more expected, you know, as a man, maybe that you might lose your hair. But when women start to lose a noticeable amount of hair, it's really hard on them, like really, really hard. It's really heartbreaking to hear what they've gone through, and even they're trying so hard to figure it out. And
Yeah.
it just breaks our heart. So
No, for sure. It's a big, big problem. Hair is a very emotional organ. You know, it determines how your day is going to go. Maybe
yeah,
from the time that you wake up and, you know, the humidity out there in the air, how that's all going to go. But when it starts to physically shed, or you see less hair on your scalp, or you see more scalp shining through, your ponytail is shrinking, more hair in the drain, and all of this, it can be a very big, you know, depressing situation and anxiety causing situation, because it's almost like it's out of your control in some ways. You just see the shed. And of course, if you shed, let's say, even just right after childbirth, it's not like the next day, it's 6 or 12 weeks later that it starts to happen after those hormones have crashed back down to normal. And so if there's been some kind of intervention, you know, you've had a surgical procedure, or you've had COVID, hopefully you don't have long COVID, because that seems to just come in waves. It just keeps
yeah,
going on and on and on. So, but the good news is that there's a lot that we can do. I guess your point is that there's no socially acceptable option for women. I mean, you know, unfortunately, I think Sinead O'Connor just passed away, and she was one of the
mhm,
only, you know, icons of a shaved scalp,
yeah,
really, other than when Britney Spears kind of lost her mind and
right,
shaved her head after all those extensions, which probably caused hair loss.
yeah,
Um, you know, you can't be Dwayne the Rock. You can be Dwayne the Rock Johnson if you've got, you know, if you're a guy and you've got, you know, some hair loss maybe and the physique to match.
yeah,
But you know, look, I mean, you know, hair loss that happens to a guy in his early 20s also can be an emotional situation as
of
Absolutely.
well.
course,
And
yeah,
a lot of our moms and dads, you know, looking at their kids, seeing early male and female pattern hair loss, you know, bring them in for early evaluations and treatments, and that's really the key.
yeah.
So if you're noticing, like someone's noticing that they're starting to lose hair, right? What are some of their first steps that they should start doing? Like what is some advice that you could give them?
You mean aside for looking for that magical miracle
I
cure on
know there's
Amazon
no
right away?
a magical pill, right? That we all want.
Yeah. So first thing is, don't panic, okay? And you know, because this could be something that's just a temporary situation, but I will tell you, it's critically important to get an evaluation, to
Mhm.
speak to someone who is, you know, evaluated literally thousands, if not tens of thousands of people who are struggling with the same condition. And so this is not going to be some AI, you know, chat GPT answer for you while you're losing your hair. You know, you
Right.
need to speak with a clinician, someone who has experience. And this may not necessarily be your dermatologist. And
Mhm.
unfortunately, today, hair restoration is a very, very important subspecialty, and it's kind of an orphan subspecialty. So I guess the evaluation process is the most important. I mean, years ago, the dermatologists didn't have many tools at all in their
Yeah.
armamentarium, and they would kind of send you out the door with either, like, you know, a shrug, or, you know, a bottle of Rogaine in your hand, and that would be the kind of the
Yes.
end of it, obviously without even a further discussion of what could be going wrong. They just, like, you know, give you something. Well, of course, we're going to measure your hair in the office, and we have a lot of ways to do that. AI powered microscopes. We're going to get a detailed medical history. We're going to find out what's gone on in the past, what your hair loss situation looks like in your family. And so there's a whole evaluation process, and it's not a quick bit of business.
Yeah.
And, you know, I spend about an hour with every patient, not only just doing the measurements, but getting that detailed medical history to find out exactly what's going on. And if you can't do it in the office with the microscopes and things like that, then we do it just like we're talking to you virtually with a video call, to at least get the idea of what's happening so we can figure out what are the main triggers, what are the main causes, and then what we can do about it.
Mhm.
Yeah. What about scalp health? Like, how important is that with all this?
Oh my gosh, yeah, you hit the nail right on the scalp, as I said. Um, so I'm a huge proponent of improving scalp health. In fact, so much so, I have an entire trichology department inside my clinic here in Boca Raton. So at Bauman Medical, if you have a scalp, let's say, itching, irritation, oily, dry, flaky scalp, if you have some kind of scalp symptom or situation going on, we are going to take a detailed look at that. We're going to look at your the moisture level, the sebum level. We're going to look at microorganisms, see if the microbiome is dysregulated. What's your hygiene protocol? How often you're shampooing? What's your lifestyle factors that are, do you sweat a lot? Are you outdoors a lot? Are you indoors a lot? You know, all of these different things are really, really critical because if you have inflammation at the level of the scalp, first of all, it doesn't feel very good in
Yeah.
most of
Right.
the cases, but also it doesn't provide a great environment to grow good hair. So everything from circulation and inflammation is critical to look at when it comes to scalp health. And so I'm very, very keen on that. We have an entire department staffed with several people. My certified trichologist, Kimberly, is amazing. She's incredible, super highly internationally trained trichologist. So trichologist, for those who may not know, is a specialist in hair and scalp. So kind of like what an esthetician or skin expert, a medical esthetician would do for a plastic surgeon. That's what a trichologist can do for a hair transplant surgeon like myself.
Yeah, I
Yeah.
love that because a lot of people we work with get seborrhea or,
Mhm.
some type of flaking due to, inflammation most of the time. And
Mm.
with the flaking, hair comes out too. And I
Oh,
see that a lot.
100%.
Mm-hmm.
100%. And so many of our treatments are designed to cool things down, just like calm it down.
Yeah.
There's a lot of ways to do that with scalp treatments in the office, things that you can do at home, red light therapy,
Oh,
nutrition and nutraceuticals. I mean, there's so much that we can apply to really cool down that inflammation. And then if there's flaking, excessive flaking, psoriasis, things like that, there's exfoliation treatments that we do in the office. Think of like hydrofacial or a facial for your scalp. We do all of that.
that's
That sounds
awesome.
amazing.
I
I want to
know.
come there just
Sign
to
me
have that
up.
done.
Exactly. You mentioned laser, right? Can you talk a little bit about the difference between laser and like LED light therapy and, some of the things you're seeing, how it's helping people? Because
Absolutely.
it's a hot ticket. You hear the caps and all the things, right? So fill
For
everybody.
sure. So I'm a huge advocate for red light therapy. I've been using low-level laser light, which is now called photobiomodulation therapy, using that in the practice since 1999. I
Oh,
had my
wow.
first in-office red light therapy device imported from Sweden in the office, and we used it initially for people who had some early thinning.
Mhm.
And it was amazing to see not only that their scalp health improved from that red light therapy, also gave them a little bit of a relaxation response, which I learned later how red light therapy affects your body systems, and especially if you're shining it in your eyes, so to speak,
Yeah.
and exposed to that at night. But most importantly, improves circulation, healing, and then hair growth. So I was a huge skeptic because nobody in medical school told me that you could apply light therapy to skin or even animals and have any kind of effect other than shining it in their eye,
Right.
right? I mean, seriously, nobody told me that. And so I was a big skeptic and I couldn't believe that the results I was getting with these in-office lasers. And of course, they were very powerful, not very portable. And when the portable devices came out, they were much weaker, much watered down version and more difficult to use, to be honest. And so it really took some rigorous scientific trials to show hair regrowth from red light therapy, but we were able to do it. And then years later, very, very smart researchers like Dr. Michael Hamblin out of Harvard and Mass General did all the studies on photobiomodulation and phototherapy to nail down the mechanism of action. So today we know how red light affects mitochondria, increasing ATP production, the energy within the cells, and provides that energy to the highly metabolic cell populations within the hair follicle to improve hair growth. So it's a really exciting technology. But yeah, laser caps and helmets and things like that. There's consumer devices, and then
Uh-huh.
there's also the medical grade devices, which are much more powerful and have a great track record of success. And we use those in the office as well as send patients home with those.
Oh,
That's so
great.
great.
So,
Yeah.
so some patients, they could call you, have a consult with you, and get some of these devices from you.
Oh, absolutely. The turbo
Awesome.
laser cap is a completely portable device. It is a medical grade device, FDA cleared for hair regrowth, so you know it's going
Love
to
it.
work if you use it. Now, you got
Mhm.
to take it out of the box, you got to get it to go, but
That's with
red light
anything,
is
right?
for sure, for
What
sure.
about nutrients that people should focus on for hair strength?
Yeah. So, I mean, first of all, you want to make sure you're not nutrient deficient. So if
Mhm.
you're on a special kind of diet, if it's caloric restricted, obviously you want to be careful because you could be protein deficient very quickly when it comes. And remember, I said the hair follicle is the most highly metabolic cell population in your body. So if you're protein deficient, if you're, even vegans, vegetarians very commonly
Mm.
are deficient in protein. They're not getting enough protein in their diet in order to grow good hair,
Yeah.
unfortunately, or heal from a hair transplant. So that's really important. You want to be able to grow good hair from the
Yeah.
get-go. And so there are other things that we need to be looking at too if you're iron deficient. So,
Yes.
and today there's, a lot of debate on what really causes iron deficiency, obviously, and all these different things that are happening. But ferritin levels are something that we look at. And again, if you're on a very strict diet, or for example, if you're menstruating, you have heavy periods, you want to make sure you're not iron deficient and that your circulation is good. So as we age, our circulation ages too. I think there was some prominent physician, the name escapes me right now, that says we're as old as our arteries. And
Hmm.
so as circulation decreases to the skin, it's kind of like that highway turns into a city road, that turns into a dirt road, that turns into a path into the forest. And that's the tiny little blood vessels that go to the tips of our nose and the edges of our skin. And if
Yeah.
those blood vessels start to diminish in their quality and elasticity, then you're not going to get good blood flow to the scalp. And so these are important things, but there are good nutraceuticals that we put together for our patients. I'm really keen on that. I've got an entire
Mhm.
wellness system for hair called NutriTeam under the Bauman MD brand. And it includes collagen protein, multivitamin with minerals. It also has a probiotic in there. I've got another one that's specifically for biotin enhancement and other things. Like, for example, ashwagandha. If you're really stressed out, we want to get some ashwagandha on board
Mhm.
and things like that. So those are just some of the basics that we have in the nutritional supplements that we provide to patients.
It's
So these are
great.
specific, yeah.
Yeah.
Because
We,
stress
and,
can
and
be
we
a big
curate
cause
other
of
ones
hair
too.
loss.
Oh, 100%. So,
Yeah.
cortisol, right? Cortisol is a stress hormone. If you're under a stressful situation, lockdowns during COVID, or you're changing
Hmm.
life status, or your job has changed, your marital status is changing, your business status is changing. These are all very, very strong triggers of stress. And you can tie it right down 6 weeks later, that
I know.
stressful time to the shed that, turning those hair follicles off, causing what we call a telogen effluvium.
Yeah.
So stress is a killer. Yeah. I mean, on all the different organ systems, not just your hair.
Oh, right. It's that's not the truth, right? We all see that with our patients. Um, so you know how peptides are just the talk of the talk right now. Can you talk about some of the latest advancements or of what you've seen with peptides helping hair restoration and even things like PRP?
For sure, for sure. So peptides, yeah, are all the rage right now. A lot of people are on hormone optimization therapy and using peptides to improve growth hormone naturally. They can use peptides for muscle recovery after a strong workout or healing gut problems. But the peptides that we typically use, specifically for hair, are delivered through a technology that we call TED, transepidermal delivery. So this is a treatment that is not replacing PRP in the practice, but as an adjunct for people who don't necessarily want an injection. So
Mm-hmm.
a TED treatment, transepidermal delivery, uses ultrasonic sound waves in a technique called sonophoresis to push growth factors and peptides right through the skin, even large molecules, without a needle.
Wow.
This
Wow.
technology has been around for a long time, but growth factors and peptides are what's in the serum. So you can push medications through the skin too this way. That's what they did in orthopedics for many years, corticosteroids into the knee from the 1950s or 60s, I think, using sonophoresis. But we use sonophoresis on the scalp. We're using this TED device to push something that contains copper peptide, a thymosin beta 4 derivative called proherin B4. It also contains growth factors like FGF and also VEGF, which is really, really good for increasing blood flow and stimulating hair follicles.
So
So that
cool.
serum gets applied through the skin literally within about a half hour, 40-minute treatment. There's no recovery or downtime. Most patients kind of sleep through it. To be honest, it just feels like a vibration. It's a very relaxing treatment. And usually it comes in package of 4 treatments, 1 month apart. And then we can measure the hair growth coming on after that.
Yeah.
That's so cool. I love that you guys do all different types of things.
Mm-hmm.
It's not just one size fits all for everyone.
Sure. Yeah,
Yes.
that serum is off the shelf. So it's the TED plus hair care serum is utilized with that technology. But if somebody wants our more traditional methods like PRP, we're going to use platelet-rich plasma with a very, very high dose of platelets. So we have a very specific way to do that, to extract the platelets and separate them through a dual spin centrifugation process right at the bedside. We measure how many platelets you bring to the office, so we measure your blood concentration, and then we measure the platelets in the final PRP before we inject it under local anesthetic. So it's painless.
Yeah.
So good. Do you have
That's
a
just a
lot of
once a year
people
treatment.
do you have a lot of people traveling to you from out of the state and even maybe the country?
Yes, so we have about 50% of our patients come in from out of town for procedures and treatments and hair transplants and even evaluations. And that's because we're listed as one of the top 20 in the world. As you probably know, I've been ranked pretty highly also in the US for many, many years.
Mm.
And so we do have a lot of patients coming in from all over. But today the practice has really grown, 25, 26 years later through word of mouth. So
Oh, yeah.
people tell their friends, they tell their family, they tell their coworkers now, and we have referrals from physicians from all over the world sending us their patients who are struggling with hair loss and want to make sure that they're well taken care of. And that's what we do. So yeah, it all starts with that virtual consultation at the website.
Did you see a big rise in people coming to the practice after COVID?
Well, COVID was very, very interesting. Obviously, we were shut down for 6 weeks here in Florida due to the moratorium on elective procedures. But when we reopened, we started slowly with all of the protections in place because obviously, we just
Yeah.
wanted to keep everybody safe as we wanted to. And but then there was a huge explosion of patients interested in hair restoration treatments and procedures. And we had been doing virtual consultations for many, many years. I mean, we were using Skype before Zoom, many years ago for video calls and so forth. But I think what happened is that people were now virtualized,
Yeah.
looking at themselves on Zoom, in a board meeting or
Oh,
chatting with friends or in a reunion, and all they saw was this, from the shoulders up,
yes.
and
True.
they wanted to make some kind of action. And so, hair restoration certainly got a big boost in that regard. And then, of course, I've treated over 1,000 COVID hair loss patients and countless others who have had a COVID vaccine related hair loss
Yeah.
situation, which now just came out in the published clinical reviewed, peer reviewed research. We see reports from all over the world from a variety of different vaccinations triggering a hair loss situation, not just male and female pattern hair loss, but reactivating autoimmune conditions, and you can name it all.
Absolutely. We
Yep.
see that too. For sure. For sure. I'm glad it's coming out, right? Everything that we're seeing in practice is coming out in the research now. So one thing I wanted to mention, because I know listeners are going to be thinking, so what all these different things that you're talking about, scalp health, nutrients, the PRP, peptides, all these things are really important. But someone may be thinking, when is a hair, transplant necessary? Or when will these other treatments maybe not give me the effect that I need? Or maybe it's too far gone, right? The follicle is just no longer there, right? Am I saying that correct?
Yeah, sure. So, I mean, over time, the follicles can miniaturize, weaken, and that's the opportunity to protect and enhance and preserve those follicles with the non-invasive therapies that we've been
Right.
chatting about. So, whether it's, lifestyle interventions, nutrition, nutraceuticals, medications like minoxidil or finasteride. We can also use, as we talked about, TED and PRP and some other things like that. Laser light therapy, of course, at home. But if the follicle is dead and gone and beyond repair, and that can be visualized sometimes from across the room. You kind of know it's a shiny bald spot in a guy in the crown or a receding hairline. Or you need maybe sometimes you need a microscope to really determine how far gone are the follicles. If that's the case, that's when you're going to need hair transplantation. And transplanted hair obviously comes from you. We don't have a way to transplant from one person to another yet. So we take it from the good areas where there's plenty or an excess of hair around the sides and the back of the scalp and use those follicles to redistribute and reimplant into the thinning or the balding areas to permanently or relatively permanently recreate the coverage in those areas that are thinning.
That's so
How
cool.
long does that take to grow to a point where you'd feel a person, let's take a man, for instance, because
Mhm.
maybe the hair's shorter. How long does it take to where they feel like they can no one would notice, they just feel
Right.
like it looks natural?
So there's what we call the cosmetic downtime with the procedure. That's the time that you want to be under a baseball cap, basically, right?
Mhm.
Or out of town, or sitting on the beach under an umbrella with nobody around. So that cosmetic downtime for most folks is going to be about 6 to 8 days.
Okay.
Okay,
And
wow,
what's
that's not
happening?
long.
So the procedure itself can take many, many hours. Sometimes large heroic restorations could be multiple days back to back, could be even 2 to 3 days in some cases. And what you see after that procedure is completed is the crusting and the scabbing in the areas where we've done the work. So let's just say traditional male pattern hair loss, receding hairline, thinning crown. You're going to have some crusting and scabbing in the new hairline. You're going to have some crusting in the crown area. We may or may not trim the donor zone depending on the style of procedure that we use. Everything is done minimally invasive. So there, in my practice, there's no scalpel or stitches. So we don't have to worry about that business. But we have to wait for the crusting to heal and the scabs to exfoliate. And so most patients will stay in town for a couple of days after their procedure, and the crusts will flake off at about 6 to 8 days.
Oh,
Wow.
wow, that's so
Once the
quick.
crusting is gone, most patients, their skin tone is normal. Now, sometimes there's a little residual redness, but the swelling is long gone. That was only a day or two in the beginning, if at all. And of course, you could be back in the gym in 3 or 4 days because there's no stitches or staples with this method of follicular unit extraction or FUE style of work. If we're doing a female patient, we may just trim a small area that's hidden underneath her existing hair in the donor zone. So that would be undetectable immediately. And we're not taking every single hair from that zone. There's just a little layer that's going to be growing back out. So what's going to happen after the procedure is healed? Well, after that, let's say week or so, the crusting is gone, but the follicles have shut down. So the little tiny stubble is shed out, and you just have to wait for the new hairs to kick in. So how
Wow.
long that takes about 5 months.
Okay.
Okay.
So between 4 to 6 months, you're growing about 50% of the final visible result. So it does take quite a long time. 9 months, you're farther along, about 75%. And then it takes a full year in most patients to see the final result. Now, of course, it's not a ponytail worth of hair in a year, but for our women, it's going to take a little bit longer than to get 6 inches of hair, but it's going to take longer than a year. So, but those follicles will live and grow and continue to produce hair, and eventually it'll flow all back in and look great.
That's so amazing. Wow. So when you're taking the hair, let's say, what do you call it back here? The type of hair that you're taking it and putting it, you said a zone or something.
So the occipital area, which is the
Yeah.
back and the sides of the
Right.
scalp, that's the donor zone.
The donor
And
zone. Okay.
we're going to take those follicles with an instrument that's literally smaller than the tip of a ballpoint pen.
Okay.
So the instrument is very tiny. I mean, it's round and kind of cylindrical, but it has a very, very small diameter. And basically what we're doing is we're extracting each group of follicles individually. So it could be as little as a single hair follicle. And we
Wow.
need those single hairs to create a beautiful new hairline potentially, or for the eyebrows or eyelashes.
Mhm.
And then those are carefully counted and, of course, cared for while they're outside of the body. They're sorted for quality control. That everything is being looked at so that every graft that we implant is a beautiful quality. And then my team will assist me in placing those grafts into position into the sites that I've personally created. And that's what determines really the angle, the orientation, the position,
Wow.
the work that I do with the instruments to create those tiny little tunnels. And I do all of that myself.
You
Now
have a
you're
lot
not
of
going to,
patience.
huh? Oh yeah, right. With each individual.
Yeah, that's a skill for sure. Wow.
Now you're not going to see the hair loss like someone would see, right? Like let's say if it was hormonal driven. Can you talk a little bit about that? I listened to your podcast on Dave Asprey, just, I just do that. And
Yeah.
so, you were saying that like you're not going to see the hair loss like you did before, right?
Correct. So the area around the sides and the back of the scalp, in men for sure, it's really completely immune to male
Wow.
pattern or the genetic hair loss. And in women, it's mostly, uh, you know, permanent, if you will. And we can verify that by doing an evaluation. So we do that by measuring different areas of the scalp, and we can see like a teenager's density, right, in the back of the scalp. We're like, oh, this is great. So no matter what your age, you're going to keep that density. That means those follicles are genetically pre-programmed to live and grow for a lasting, long life, if you will, into the new area. And so
Wow.
the transplants are relatively permanent, but it's your other hair that needs attention, right?
Mhm.
So when you rectify the hormone imbalance, when you get your nutrition on point, you have your sleep wake cycles on point, and then maybe you're treating with it could be nutraceuticals or pharmaceuticals or laser light or even PRP on an annual basis. What are we doing that for? It's not for the transplanted hairs.
Right.
The transplanted hairs are pretty robust. It's
Mhm.
the other hairs that are at risk that we need to protect.
Nice.
So for Dave, for example, Dave Asprey, great public patient of mine who shared his entire hair transplant journey, all 4,000 and plus grafts live on the internet.
Very
Uh,
cool.
we did his procedure in the office and we went around the sides and the back of his scalp and recreated a full-blown hairline for him, a brand new, beautiful hairline in a much lower location than he had due to male pattern hair loss. And a big, big old bald spot that was, many inches in diameter. We filled that in with transplantation as well. And so that was all executed in one visit here at my office.
Wow.
Yeah.
So
Do you
cool.
do you work a lot with, alopecia patients? Because that is, oh my goodness, that is so hard. And I personally have some very close friends who go through this, even with their children. Can you walk us through a little bit of your journey with those patients?
For sure, for sure. So alopecia is actually just a general term for hair loss,
Mhm.
but most people equate alopecia with autoimmune alopecia. And so autoimmune alopecia could be just as simple as alopecia areata, which is just a little spot of
Hmm.
shedding immediately where you just get like kind of a circular area of loss temporarily. Sometimes it just resolves on its own. Sometimes guys get it in their beards. It can be triggered by stress or allergies or other things. But when alopecia areata like that progresses to total loss across the scalp, that's alopecia totalis. And that can be a very devastating condition. Oftentimes we can treat that with PRP, but we now have FDA approved medications that kind of knock out the immune pathways, if you will. They're called JAK or Janus kinase inhibitors. There's a whole slew of them that now can be used to basically block the body's attack on the hair follicles. So the JAK inhibitors, tofacitinib, ruxolitinib, a couple of other ones out there, have really made people from bare to hair, which is pretty exciting stuff.
Mhm.
Um, but alopecia obviously can also be addressed, without medications or surgery. And that would be like a cranial prosthetic or a medical grade wig. And that's something we also do in the practice. So sometimes you just need a cranial prosthesis around the time maybe you're undergoing chemotherapy where it's a temporary situation, or if you have severe alopecia and maybe you don't want those immune blockers, uh, medications, for example, or you can't tolerate them for some reason. We have amazingly beautiful non-surgical hair restoration options like Italian-made CNC, the Capelli Naturale a Contacto, which is an Italian phrase for basically a medical grade hair system.
Hmm.
That's a beautiful option for people who have extensive hair loss. And we've used those in folks who are not good candidates for transplants, like someone who has a severe burn across
Yeah.
their scalp. Let's say they don't have good
Wow.
donor hair. So she did very well with cranial prosthetic.
Wow, that's amazing.
So
You're doing
nice that you
good
have so
work.
many options.
Mhm.
So
Well, we've got
how
a lot under the roof here in my 12,000 square foot facility. We've got a lot of departments. Not just hair transplantation, which occupies most of my time, and the scalp clinic, which is my trichology center. We also do a little bit of aesthetics and now functional medicine as well. We have a Bauman
Good.
performance program because we've really uncovered so many
Yeah.
dysregulations in our patients, and they need help.
yeah.
To make their hair grow better. And sometimes the hair is such canary in the coal mine for other problems. We want to get a handle on it. And I'm sure you guys have seen that too.
Oh
Yeah,
yeah,
for
it's a
sure.
big sign that you got to look. You have to look under the hood.
Yep.
Absolutely.
Yeah. So if someone say, let's say a woman comes to you with, a good amount of hair loss, where would you start with her?
So the first thing, as we mentioned earlier, is a detailed consultation. Now,
Mhm.
sometimes that starts virtually, and they may send in information about their medical situation or even some recent blood work if they have it. We can have a conversation about what's going on. They're going to send photos of their scalp in different areas. If there's areas of concern, obviously, if they have like a patchy hair loss situation, they may take photos of that. If it's an overall issue with just some severe shedding, we'll dissect down into that situation, maybe go back into their medical history and see what's going on there. If they come into the office, we'll do that detailed measurement using the AI powered microscope to literally count exactly how many hairs there are in each zone of the scalp and see if there's a hereditary pattern, meaning, let's say, good in the back and not so good up in the front, and it's progressing.
Yeah.
Use the microscopes to see what's going on and take a detailed inventory. Maybe we do some additional testing. For example, we might look at their DNA tests to see if there's certain metabolic pathways that are influencing their hair, or that may even guide us towards treatments that might work better than others. So, taking a very personalized precision medicine approach. If there's really a lot of stuff going on in the medical kind of, uncovered in the medical situation, then they may just have to, visit with my functional medicine practitioner first or concurrently and get that, track on point at the same time. Or if a scalp health issue is uncovered, there's seborrheic dermatitis or inflammation or something else funky that's going on, some other type of scarring alopecia, God forbid, a scarring type of alopecia, which kills the hair follicles permanently. We need to address that through my trichology clinic, and they're very good at that. Um, so we're going to go take all of that information and then start to compile that and figure out what are the best interventions to get the job done. And all the different things that we talked about are in the toolbox, but they might be applied differently at different
Right.
times,
Yeah.
depending on the severity and the goals of the patient. So it's very much individualized. You can't say, oh, if you have hair loss, you do this. No, that's
100%.
not how that works.
No, that
You have
is
a
not.
wrinkle, you hit Botox. It's not like that.
No,
It's
no. We understand that fully with working with so many patients and things like that. So we appreciate that so much.
yeah.
Um, yeah, it's crazy. So what I love too with what you do, I'm sure you're measuring the hair too and seeing with all the treatments that you are doing to see if it's working, right? So as
Oh,
you're moving forward, which is so awesome.
yeah, no, absolutely. That's like the critical step, right? Because no matter what you're doing, whether you're treating the skin or you're treating, a blood biomarker or something like that, you want to repeat it. Even if you're doing some blood pressure stuff, you
Yeah,
want to see did your intervention have an effect? And
right.
waiting on your own, like looking in your mirror, waiting for hair to grow, that's like a 6 to 12 month process. And you may not necessarily be so good at judging it on your own. So having a quick feedback mechanism with these types of measurements that we do, it really cuts through all the nonsense. It cuts
Yeah.
through all the snake oil. It tells us exactly what's working, how much it's working, what areas are working, and what areas are not. And then we can proceed from there. So it's almost like having a quick feedback loop. I mean, I'm a I'm a bit of a biohacker. I track my blood
Yep.
glucose. I look at my, sleep scores and things like that. So I want a quick feedback mechanism of measurements, and that's what the measurements of hair growth and hair loss enable us to do. The Canfield system, what we call hair metrics, and even the hair check, which is just a bundle measurement on the scalp. That tells us very, very quickly what's working and what's not. So you're not
Yes.
just because remember the shed. People say, "Oh, I'm stopped. The shedding stopped." Well, okay, that's good. But sometimes treatments that we have can actually trigger a little bit of a shed. Sometimes we see shedding after PRP or starting a laser or even starting a minoxidil or something like that. And
Yeah.
that's a good shed. That means there's new hairs replacing the resting hairs that were there before. So,
Yeah.
but you wouldn't know that unless you did the measurements to determine exactly how it's responding.
Exactly, which is so important with anything with health, right? You got to measure,
Totally.
and it's amazing tools. Thank you so much for coming on. This was our listeners are going to eat this up. You're going to get even more busy, I'm sure.
Oh, well,
Where can people find you?
Well, the best way to start a hair restoration journey, if you're struggling out there with hair loss, or if you know somebody who is and you care about that person, I would direct them to baumanmedical.com. You can easily get on the newsletter, which goes out, at least once or twice a week with a lot of information about hair loss and different therapies and treatments. I write all that stuff. But to schedule a consultation, you click on the consultation form, and it's going to ask you about 20 questions to get things started. And then you'll submit some photos, and we'll chat about your hair loss situation and see what we can do to help you. If you're local to Boca Raton, Florida, you can obviously stop in. We have a 12,000 square foot facility here in downtown Boca Raton, so we're not less than a mile from the beach in the Intracoastal, so it's not such a bad place to visit to take your hair restoration vacation, if you will.
Love
But
it.
but Bauman, Bauman, baumanmedical.com is the first place to go on your journey. And you could always just ask a question. You go to baumanmedical.com/ask and just ask anything,
That's great.
and we'll reply.
Well, I'm going to come see you. I'm not kidding.
We got to work on those brows,
eyebrows.
right?
Really?
Dr.
I want
Becky,
some,
yeah, for sure.
I want to run my fingers through my eyebrows. I mean, I'm sick of this microblading.
I love you, Beck.
Understood.
Well, thank you guys for listening, and thank you so much for coming on. This was amazing.
It's really a pleasure to be here with you all.
We hope you guys enjoyed this episode. If you did, if you can pop over and leave a review, that would be awesome. You can also find us over at healthbabes.com, where you can find our courses, our latest book. We also are on Instagram at The Health Babes, at Dr. Becky Campbell, or at Dr. Crystal Hone. I hope you guys have a great rest of your day.